Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, if there is bilateral ureteral injury, and if there is bilateral ureteral injury, that means we have accidentally ligated both the ureters. So, if both the ureters are ligated, so obviously there is no urine escape. So, this will result in anuria in the patient. So, if you try to pass a ureteric catheter, okay, if you try to pass a ureteric catheter, if both are ligated, then ureteric catheter will not pass, and urgent relief of the obstruction is very important. Okay, because ureteric catheter will not pass, and thus you should do an urgent relief. The treatment of this bilateral ureteric injury is you should do an urgent relief should be done of the obstruction. So for that you should do a nephrostomy, or immediate surgery is very important for the bilateral ureteral injury. Bower's flap we have already seen, where the bladder is refashioned into a tube so that the ureter can be combined with the bladder.
thank you and thank you for watching.